Welcome to the Innovation Accelerator podcast, brought to you by Innovaccer, the health cloud company. We're on a mission to connect and curate the world's healthcare information to make it accessible and useful. With Innovaccer, everyone works in the service of patients like never before as one. Visit us online at innovaccer.com.
Hello, everyone. Welcome back to the Innovation Accelerator podcast. I'm Steve Ambrose, Director of Content Marketing for Innovaccer. On today's show, we're going to be talking about the recent partnership that is formed between Innovaccer and Guidehouse. We'll also gain insight around top challenges felt widely across the healthcare industry, as well as fresh thinking around innovation. Our guests today are Dr. Nicole Fetter, a director in the health segment at Guidehouse. Guidehouse is a leading global provider of consulting services to the public sector and commercial markets with broad capabilities in management, technology, and risk consulting. The organization was recently ranked number 3 by Modern Healthcare in its survey of large consulting firms. And Charu Madan, Vice President of Partnerships and Strategic Alliances here at Innovaccer. Dr. Fetter, welcome to the show.
Thanks, Steve. It's great to be here.
Before we get started, I'd like you to share a little bit with our audience about your background, current role at Guidehouse, and your current area of focus.
Absolutely. Happy to. So I'm an orthopedic surgeon by training, but have spent the last about 10 years or so doing healthcare consulting. I specialize predominantly in value-based care, so working with a variety of our clients on the transition from fee-for-service to fee-for-value, both from a strategic, operational, and clinical perspective.
Charu, thanks for being with us. It's nice to have you on the show.
Thank you, Steve. It's great to be here.
Please share a bit about your background, current role, and focus areas with the audience.
Yeah, sure. Steve, it's like I said, it's an honor to be here with yourself and Nikki. My name is Charu Madan, and I'm the Vice President of Partnerships and Strategic Alliances here at Innovaccer. I've been at Innovaccer for about a year, and prior to Innovaccer, I've spent almost 18 years in the high-tech software and technology space. And I've really enjoyed my stint in this industry. And I would say for the last 10 years or so, I've really been focused on developing ecosystems, partnerships, really figuring out new channels for growth for our company, whether it's through driving new business, driving new account penetration, or using our ecosystem of partners to help influence and provide a holistic solution to our customers. So I'm really excited to be here and at Innovaccer and really continuing that journey and leading the partnerships and alliances team here at Innovaccer.
Well, terrific. Let's jump right in. For 2022, Guidehouse and Innovaccer have both been named best in class as leaders in their respective areas. Guidehouse is best in class for strategy, growth, and consolidation consulting for the 3rd consecutive year. Innovaccer was recently awarded the inaugural best in class for data and analytics platforms. What I'd like to ask you both is why each of your companies felt that partnering with the other was a good decision. And I'll start with you, Dr. Fetter.
Great. Thanks, Steve. I'm really excited about our partnership. I think it's clear that the march towards value-based care is continuing. And while obviously the healthcare industry, we haven't achieved the end goal yet, I think there's continued commitment to get there. However, I think a lot of our clients see the magnitude of the challenges and the level of complexity when it comes to value-based care. And that really, to me, underscores the need for an end-to-end comprehensive solution. And I believe the partnership between Guidehouse and Innovaccer creates that end-to-end comprehensive solution. You know, when I think about success in value-based care, it depends upon a balanced approach to 4 key components: your growth and contracting strategy, operational excellence, technology enablement, and change management. You know, at Guidehouse, we work with providers to develop and execute on a strategy, thinking through how much revenue do you transition over to risk? What lines of business, Medicaid, Medicare, MA, commercial, what types of risk, upside, downside, partial cap, full cap, and how quickly to make the transition. But all of that needs to be balanced with your operational model. If you move on your strategy too quickly before your care models mature, then you risk being unable to reduce the cost of care below your target or benchmark. On the other hand, if your care model is operationally advanced, but you're slow on your strategy, you'll bend the cost curve, but the savings you achieve won't really end up benefiting you. In addition to this strategy and operational balance, what I see is that most organizations struggle to use data to inform both the strategy as well as optimize their operational performance. And that to me is where Innovaccer's ability to aggregate and analyze data as well as some of the workflow platforms is just so powerful and exciting. And then that final piece, of course, is change management. And, we could easily spend, I think, the entire podcast talking about just that topic. And so I know I'm just scratching the surface, but still think it's worth mentioning. We know 70% of change efforts fail, and most often due to people factors. That's why change management is so critical. And at Guidehouse, we've developed a people-centric change framework that leverages behavioral science techniques to help initiatives be more successful. And so I really think it's the fact that between the Guidehouse and Innovaccer groups coming together, we really create that end-to-end comprehensive solution that is kind of bringing best-in-class solutions to all four of those areas. And that's what has me so excited about this partnership.
Charu?
Yeah, thank you, Nikki. That was a great start. And I completely agree with you about the complexity in administering and delivering value-based care. And in fact, overall in healthcare, the fact that there is data silos, there is lack of a free flow or an integration capabilities, which just keeps, data locked down. And ultimately what we care about is giving the best care to a patient, the end customer. So again, just taking off from where you left off, I believe our solutions and what we do is extremely complementary. In fact, I see it as two sides of the same coin. And that's why I believe that there is so much synergy in what we do, because what we offer is more on the technology and the product and the platform side around data integration, around getting a full 360 view of the patient using a disparate source of data and getting that together. But like you said, a technology implementation or effort is completely cannot reach its end objective unless it's accompanied by great project management, great visibility into where you want to be and how that roadmap is developed. What are the steps that need to be taken? And through that process, that change management and operational process optimization, because again, you can take a technology, but if you don't change the downstream operational processes and how it all comes together to then drive impact, it is incomplete. And clearly, Guidehouse is the leader in helping customers through that journey, through that strategic journey of starting at point A and reaching point B. And then I think of Innovaccer as that vehicle to help get there. But really, Guidehouse is almost like the driver and the navigator who then helps customer make the best use of what they're getting. So I feel our capabilities are very synergistic, and that's why I'm so excited to be working with your team, Nikki.
A January 2022 study by the nonprofit RAND Corporation, published in the JAMA Health Forum, showed that volume-based compensation was the most common type of base pay, specifically for more than 80% of primary care doctors and more than 90% of specialists at medical practices owned by health systems. Now, while systems still use financial incentives for quality and cost performance measures, the percentage of total physician compensation based on quality and cost was just 9% for primary care providers and only 5% for specialists. Dr. Fetter, what steps do you see as needed in moving value-based care to a stronger and more substantial presence, not only in healthcare systems, but to grow larger at the provider level?
Thanks, Steve. It's a great question. I mean, obviously, I think the compensation piece is an important component to it. I mean, if you just look historically at when DRGs were introduced, that had a pretty dramatic impact relatively quickly on hospital length of stay. So, when you change the reimbursement or compensation model, you'll often see subsequent changes. And it really has to do with aligning incentives. But I think it's really is going to require more than just simply compensation changes. I think it's hard to expect physicians to do things differently when the overall model is still set up the old way. So what I mean by this is that we expect physicians and clinics to do more and more, but haven't substantially changed their daily workflow. One example is, I've worked with a number of ACOs and CINs that provide wraparound services. So things like chronic care management. And don't get me wrong, those services are important. They're great. But those same organizations typically haven't worked with physicians on practice level transformation. What needs to be different in terms of how the clinic workflow is structured? Everything from panel size to scheduling, pre-visit preparation, during the visit, and then post-visit follow-up. I think we'll see value-based care become stronger when we're able to do that practice level transformation combined with compensation changes. Obviously, there are some notable organizations that have already started to do this level of transformation. ChenMed, I think, is one well-known example that comes to mind. They've completely restructured how patients are cared for, and their model is working. They have smaller patient panels. Patients see their providers more frequently. They provide transportation. They have some on-site specialty care. They've developed robust technology systems. They take on full capitation, and they do a 9-month training program for their physicians. So when you think back to those 4 components that I was speaking about, they're really kind of ticking all the boxes. Obviously, though, they are really focused on a specific population. And so I think the challenge for health systems and large provider groups is that they typically see a much wider array of patient complexity, from the healthy to the very chronically ill. And so to me, I think that's an area where we need to become more innovative as to how we approach that level of patient and clinical diversity when it comes to practice transformation.
Charu, COVID has in many ways ripped the Band-Aid off many vulnerabilities through our health system. While challenges and pain points have arisen in healthcare organizations and with patients, it's also become a time for significant opportunities to disrupt and innovate. How is Innovaccer's Innovation Partner Program tapping into disruption and innovation?
Yeah, that's a great question, Steve. And I say it this way. While COVID has had its dark moments, there is always a silver lining. And I think the silver lining for COVID has manifested itself in 3 main ways. The first way is that it's making providers more acceptable to adopting technology. So that's number one change that is happening. The number 2 change that has happened is it is making consumers and patients also more amenable to using different ways of getting care. So that's the change which is happening on the consumer or the patient side. And the third thing is it is fostering an ecosystem of companies who are driving innovation to take advantage of those first two phenomenon that's going on. So while COVID has been a very dark moment and a dark period in the entire world's sort of history, I would say, and we are still not really out of the woods yet, but that has been the silver lining. And then if I were to translate how the Innovation Accelerator program is setting up an environment and an ecosystem to drive innovation, I will repeat something that I said earlier. It's breaking down the data silos. We are giving other innovative companies a platform, a basic infrastructure to come up with new solutions, new applications, which are really, truly disruptive in the market and are completely transforming the way care is delivered, the way patients are taken care of. So I feel like this ecosystem and this platform that we have developed is giving more companies an opportunity to jump into this innovation bandwagon. And I feel that's where Guidehouse comes in, because again, Guidehouse has the rich expertise in providing consulting, deep expertise in clinical workflows, So Guidehouse, I think, will become the tip of the spear in helping end customers adopt all this innovation that's happening, incorporate that into their workflows, and ultimately let technology have a direct impact on the outcomes. So I see Guidehouse as a real, corner point in making the strategy real and making the outcomes real in the world of healthcare.
And Charu, I'd like to follow up with that question. If we look all across the healthcare segments, what 2 or 3 challenge areas do you see tremendous opportunities in for radical innovation and out-of-the-box thinking?
Steve, you know me, I always will turn a challenge into an opportunity. So let me answer the question from the opportunity perspective. So I think the 3 tremendous opportunities I see emerging in this field are around interoperability and breaking data silos. That is by far, one of the top ones. I feel the use of AI, the artificial intelligence, machine learning is another trend we see. And that trend I see has such a big impact in reducing physician burnout and reducing nurse burnout. So I see that as a key disruptive trend in this industry. And I think the number 3, I would say, is this whole notion of digital transformation, which ultimately leads to business transformation. And all this, the cornerstone is moving some of your legacy applications, your legacy technology onto the cloud. So we are seeing a tremendous amount of innovation in that area. So I would say in my mind, these 3 things are what's driving the topmost opportunities in the world of healthcare.
Dr. Fetter, according to the American College of Healthcare Executives annual survey of top issues confronting hospitals, personnel shortages ranked number 1. Top financial challenges, which has held that top spot for the last 18 years. Can you share a bit more about how personnel has impacted your healthcare provider clients? And adding on to that, how Guidehouse is approaching strategy to help the clients with the challenge?
Yeah, happy to. We're definitely seeing this as a common challenge across many of our provider clients. Obviously, the past 2 years have been really difficult for everyone, but especially for the brave men and women in healthcare. And not just those providing care, but those behind the scenes, from food service to administration to environmental services. We're seeing clients struggle with burnout, which can lead to quality and safety challenges, as well as resignations and early retirements, which creates those personnel shortages. I think what's different this time, healthcare, I think, has always struggled from time to time with staffing shortages, but what's different this time is the magnitude is so much greater. In the past, staffing shortages were incremental, and you could almost always find a way to cover it. This time, however, we're seeing some health systems that have lost 25% of their staff. They're having to turn patients away, close beds, postpone elective surgery, board patients in the ED. In terms of how we're working with clients, I'd say there's a variety of strategies and solutions. One example is to look for opportunities to reduce consumption of services through improved efficiency, throughput, and capacity management. This can take a number of forms. One that I think we're really excited about, and is something that Charu recently mentioned, is leveraging automation. What routine tasks can be automated that reduce burden on staff? For example, there's a number of steps in the financial process around submission, review, and approval of authorizations where we see automation opportunities. We're even looking for automation opportunities with things such as discharge planning. Another way to look at reduction in consumption is to think about where care should be taking place. Since COVID, there's been increased interest in providing care in patients' homes. So, is there opportunity to implement innovative care models such as remote patient monitoring or hospital at home programs to free up capacity at your hospital? These programs typically involve a combination of staff, but then also with a technology-based platform and workflow that's really designed to help staff, improve their efficiency through creation of alerts and prioritization based upon patients' current level of need. Finally, I think there's an opportunity to improve employee retention through enhanced engagement. We recently worked with a provider client that was struggling with nursing shortages. We did a series of working sessions that included nursing directors, HR, managers, and frontline nurses, and helped them identify what were the most important motivators to nurses. What I think is so fascinating about this work is that the most important motivators were things like taking care of others, feeling valued and respected, free time, and belonging. Things that weren't ranked very highly included what I kind of think of as your typical HR benefits. So crisis pay, health insurance, referral bonus. And so I think this just really underscores that you can't engage your employees until you understand what truly motivates them and then put in place initiatives to address those motivators.
Charu, in so many ways, your area at Innovaccer and in partnerships and alliances, it's really a microcosm of what's happening broadly across the healthcare ecosystem. Specifically, healthcare organizations that are reaching out and reaching across and even outside their market segments. Where do you see the biggest opportunities for partnering, both within and outside the healthcare ecosystem?
Yeah, Steve, the opportunities exist on both sides, within the healthcare ecosystem and outside of the healthcare ecosystem. I think of it as northbound, southbound, eastbound, westbound. So when I say eastbound, westbound, I mean reaching out within our industry with other companies like ourselves. They're technology companies, they're focused on healthcare, but they offer solutions which complement our data platform. So that's one kind of partnerships that we are fostering in our industry. Then if you think of sort of the northbound partnerships, I see Guidehouse as a cross-segment, cross-industry powerhouse in technology and consulting and the change management that they bring to the table. And again, what's really exciting about Guidehouse as a partner is that they have great capabilities in both the public sector as well as the private sector. And that's a very unique combination because they're dealing with important policy compliance issues, and we find that very synergistic with what we do. So that would be an example of a partnership which is with a more horizontal company, but then, we are really focused from a healthcare standpoint. So really, I think the answer is it's both, and there are opportunities which exist on both sides. And even when we partner with our cloud partners like AWS and Microsoft, those are, again, cross-vertical platforms. But because they're cross-platform, they have brought in the expertise and the learnings from across various industries. And I think we get the benefit of all those learnings. So I hope that answers your question, Steve.
It does. This next question is really for the both of you. I know that Innovaccer and Guidehouse are heavily invested in the value of data and insights, really in empowering interoperability. It's going to benefit the patients, the healthcare organizations, and also care outcomes. Would you say that the lack of interoperability and the lack of companies to capture greater value from the data they hold is impeded more by technology or human-based causes? And I'll go first to you, Dr. Fetter.
Thanks, Steve. Honestly, I think it's both. Data is typically siloed across multiple tech platforms, as Charu's been speaking about. And I think, it's hard for a lot of organizations to find that single source of truth. I've also, in 10 years of healthcare consulting, had a client who said, oh no, I have too many IT staff and I'm looking for projects for them to work on. So, I think from a data and people perspective from that side, I also think that a number of clients don't know how to leverage and use the data that they do have access to. You can have a great IT tool or platform, but if you don't incorporate that into your workflows, you don't use it to inform your decisions, you don't use it to define your KPIs or measure results or identify barriers, then it's really not doing you any good.
Charu, going to throw that question to you. Is it technology or human-based causes that's holding back interoperability the way you see it?
Technology definitely is a reason, but it's not due to lack of technology that the issues exist. There are so many other overall aspects related to healthcare around privacy, around risk, around compliance, that even if you bring in technology, to actually implement it and get it to a point that it's useful, it's fraught with barriers because of the privacy issues and compliance areas that exist within healthcare.
And I wanted to follow up with that last question with this one. Dr. Fetter, how are you working with your clients at Guidehouse to get greater value from their health data?
Yeah, thanks, Steve. I think one of the things that we really try to encourage our clients to do is to, make use of the data that you do have. A lot of times I've seen clients, not want to put anything forward because they feel like it's not perfect. And then they end up never making any progress. And, I know especially when you're taking data to physicians, and physicians have a tendency to poke holes in data. You really want it to be as perfect as you can get it. And I recognize that, but I also know that if you never move forward, you don't use the data at all, you're never going to move forward. And so I think it's using the data you have, but then being transparent, and upfront and transparent, about some of the limitations of the data and how you're planning on making it better over time.
Here's a final question for you both. Imagine you could snap your fingers and fix just one problem in healthcare today. What would it be and why? And I'll start this answer with Charu.
It's a great question, Steve. If I could snap my fingers and ask for that magical genie, I will actually go with something Nikki just said some time back. It's about not letting perfect be the enemy of good enough, encouraging the users to start using the data and derive insights, even if it's doesn't have all the elements, but we got to start somewhere. So the thing I would love to change is really, like I said before, breaking down those data silos, bringing in as many sources of data to really get a unified view of the patient, a 360 view of the patient to be able to deliver better outcomes and better recommendations. So that would be the thing I would change.
Dr. Fetter?
Yeah, thanks, Steve. And Charu, I completely agree with you. And I think it's a little unfair that Steve said that I can't fix the healthcare system. But since I can't, I guess I'd have to say that, I'd love to see closer collaboration between payers and providers. Historically, the relationship between payers and providers has been at times contentious. I think the system will work better, if those two groups can figure out how to better collaborate. I think a part of that collaboration obviously is data. And I know Innovaccer has deep expertise in this, and that fact that, payers tend to have deep access to claims data. Providers have the EMR data. Obviously, one of the challenges is payers work with so many different providers. And to a lesser extent, providers work with a number of payers, so that being able to get each other's data can be challenging, let alone, being able to do something with the data. That said, I think it goes beyond just data. I think there's opportunities for collaboration around things like reducing duplication of efforts. So things like care management, financial authorization clearance. So I'd really have to say, better collaboration between payers and providers.
Dr. Nicole Fetter and Charu Madan, it's been a privilege and a pleasure speaking with you both. We look forward to doing it again really soon.
Thank you.
Thanks.
Our thanks to Dr. Nicole Fetter and Charu Madan for sharing their insights on the show today. For our listeners, don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned to the Innovaccer podcast for more shows covering the healthcare IT topics that you care about. For more information on this and other healthcare IT topics, please visit innovaccer.com. I'm Steve Ambrose. Have a great rest of your day.
You've been listening to the Innovation Accelerator podcast, brought to you by Innovaccer, the health cloud company. Don't forget to check the show notes for links to related resources and other information. And stay tuned to the Innovation Accelerator podcast for more programs about the healthcare IT topics you care about. Accelerate your transformation and build the future of health on the Innovaccer Health Cloud. For more information, please visit innovaccer.com.